Nelson. Today we are here from Sky Solutions to provide you with our expertise in information systems and business strategy. My name is Julie and I'm the Director of Finance. I'm accompanied by my colleagues Cameron, Enterprise Architect, and Heidi, Director of Project Delivery. Mr. Nelson, we would like to acknowledge that you have a business opportunity to capitalize on the clinical adoption of EMR integration with EHR to transition to develop a pan-Canadian electronic health record. Secondary issues to address with this business opportunity include resistance from physicians, which will require change management, along with system improvements and the security in this industry as a public health sector. We would like to let you know we're very excited to be here today and address your question that you've asked us of whether or not there is a business opportunity to take advantage of. We would like to recommend that you create a small business group to facilitate in the transition of the integration of EMRs and EHRs. We will be addressing this as listed in today's agenda, and we'll be hearing from all three of us for this. Jumping right into things, looking at a SWOT analysis. The strengths that you have at your fingertips right now is the fact that you have experience behind you from a small information technology firm. You have been very successful in the past, and as we have been informed, you do have past colleagues on board and interested in this project proposal. This diverse work team has been acknowledged as a strength, especially with one colleague who has been working in Europe, in Norway, in the health sector with EMRs and EHRs there. Areas for improvement, we would like to acknowledge that right now you are not a formal company, and this is going to be very important to develop before going forward. Opportunities in the industry. Right now, you have potential customers. Canada is placed and ranked 9th out of 10 right now, which is very low, with their ERM adoption status. So acknowledging this, there's abundant opportunities for you to take advantage of across all the provinces, developing this integration of the systems. Business analytics we'd like to briefly mention as an additional opportunity in the industry to create sustainable competitive advantages and smoother transitions for physicians working in the industry. Clinical adoption resistance we will be addressing throughout today's presentation because it will be a threat and something that you will need to work through in order to get physicians on board, to have them understand the need for systems to be in place for medical records and not to be only using paper sources for their record keeping. I would now like to introduce Cameron to discuss the decision criteria that we've used to look at our 3 strategic alternatives. You will see me again in the presentation to address the financial analysis.
Thank you, Julie. Mr. Nelson, you have an opportunity to enter a market that has an extremely high potential for growth, but you need a strategy. How are you going to enter the market, and what's your position going to be in the market? When you're deciding on this strategy, we want you to look beyond just the opportunities in Alberta and the opportunities in the entire Canadian healthcare industry in terms of integration and IT. We want you to look at the situation right now in terms of InfoWay and how they're committed to establishing this pan-Canadian integrated health record system. If you can come up with a business model that assists them in doing so, not only will you make a lot of money, but you're also going to save a lot of lives. But how do you develop this strategy? How do you decide on it? And first you have to think about is competitive advantage. What distinguishes you from your competition in this market? And just to narrow in on a little bit more on that, the second criteria, which is this small business focus. We've identified a core competency in your organization in terms of, or in your past, in terms of working with small businesses, and through Porter's analysis, we've analyzed and discovered that there's right now a gap in the market in terms of a successful IT organization that is able to communicate with small businesses, specifically with physicians and other members of the healthcare industry. And finally, sustainability. This goes back to looking beyond just the opportunities in Alberta and can come up with a business model that will help you remain profitable well into the future. In terms of deciding on your alternatives, I want to first reemphasize who your customers really is going to be. Who's making the decision to hire you and who's writing your paycheck. And this is the province. The province is the group of people who have the economy to make these type of decisions. They have the budget and they have the mandate to install this integrated system. To simplify it, you're selling your services to the province based on your ability to provide value for physicians. And we've identified 3 strategies in terms of how you could possibly do this. The first is to position yourself in the market as a implementation, specifically small business implementation, specialized consultant. After the vendor has been selected by the province, you would then come in, work specifically with the doctors, with other physicians and other healthcare professionals to help them implement this system and really provide value and show them what value is in this integrated system. The second option is to position yourself as a vendor selection specialist. Right now there are multiple vendors in terms of the infrastructure of how you're going to integrate your systems, but there's not a concrete way to evaluate them. You provide value to the province by coming in and looking at different vendors and analyzing them, and specifically looking for business analytics and being a specialist in business analytics. Business analytics are the future of healthcare and is the future of IT and healthcare. What this will allow doctors to do is they'll be able to make better decisions and really find patterns in terms of whether it be patient records or drug prescriptions or practices which they never even knew or never could discover without business analytics and without the help of IT. And the final alternative is a hybrid. Do both of these. And the reason why this is an alternative is because the first 2 alternatives don't fully fit all 3 decision criteria that we've laid out. As you can see, this positioning yourself as just a small business implementation consultant doesn't allow you to truly create a competitive advantage. There's lots of consulting firms that specialize in implementation, but there's not a lot of firms that specialize in business analytics and really bringing value to the customer. But by just focusing on business analytics and vendor selection, it doesn't allow you to take advantage of your strengths and your current core competencies in terms of working with small businesses and in terms of really making sure the systems are successful and the physicians buy into these changes. We suggest that you implement this hybrid model in which you will do both. You will first work with the province and suggest a vendor that has the capacity for business analytics, and then after selecting the vendor, you will then work directly with the physicians to ensure implementation is successful. But this is easy to say. The main value that you're going to add is to work with the physicians. It's easy to convince the province that you're going to be successful, but the key part is convincing these physicians who right now are a little bit hesitant to buy into the system. And what you're going to have to do is utilize a change management structure and really show the business, the physicians, how they're going to get value from this integrated system and focus on the bottom line. You're going to focus on how, by switching to e-records, you'll save paper and contribute to environmental sustainability. By switching to e-records and an integrated system, physicians will be able to see more patients every day and ultimately increase their profit margin, but most importantly, the social costs. By switching to this system, an integrated system, physicians can make better decisions and can better find trends to help increase quality of patient care. And this is what physicians want to do. Physicians care about their patients. They care about providing the best care possible, and they cannot do that without an integrated system. You have to, by selecting this alternative, and by going forward with this strategy, you must position yourself in the market to be successful well into the future. But it all rests on brand recognition, and that specifically is your first client. How will you adapt to the situation and the challenges in Alberta, and how will that position yourself in the future as a strong reputation? Heidi will now talk to you a little bit more about the specifics to the Alberta situation, as well as how you can expand your company into the future.
Thank you, Cameron. Now, Mr. Nelson, in our past meeting with you, you had some very specific questions that you wanted to address during our discussion today. And we've added that to our discussion specifically on your request. Now, the first question you asked was the degree of integration that you thought was possible or sustainable in this venture. Now, we believe partial integration is the proper channel for this question. And we think that by really determining which medical information is pertinent to be used, pertinent to be integrated, and which information is not pertinent to be integrated. So we understand that your friend Alfred is very concerned about his personal notes. Perhaps you're to remind him what questions to ask him in the future. Or perhaps it's just something personal for him in direct relation to the client. Perhaps it's something that doesn't necessarily have to be shared with the entire medical community. So we believe information like that can be held privately, but also in an electronic format. Other information that's very pertinent to the medical industry or to other medical conditions, that will be fully integrated into the system. Now you also asked about medical practices and how you're going to accommodate with these integrations. Well, as I mentioned, there will be no open EHR integration, but there will be those e-notes that I will discuss in just a moment, and we'd like to facilitate those paper-based notes more onto the system at that point. You've also asked us a question about if there's an opportunity in this space, and we've addressed that. Yes, absolutely, there's an opportunity for you to capitalize on. And you also asked about perhaps what kind of skill set would be used in your core competencies. Well, we think that by having a very specific focus on physicians, as well as having a full implementation focus for small businesses, as we've done in the past, in this case, physician, you'll be able to distinguish yourself in the market, and in this case, the Canadian healthcare market. Now, going forward, we've noticed that your organization is very loose at this point. In fact, you've just talked on the phone with a few of your past colleagues and decided that perhaps this is an opportunity you'd like to move forward. But we've decided, or we're recommending, that you do develop a group. And we've come up with a name for your group, in fact, the Canadian Medical Trust Corporation. And the mandate for this group is to assist healthcare providers in providing the highest quality medical care possible when utilizing emerging IT to support increased efficiencies in business and medical processes, to facilitate better healthcare, and ultimately to create a better Canada for all individuals within the country utilizing EMRs, medical records, and other electronic records. But looking into the actual implementation side of things, I'd like to stress here that for your organization to really grow, it is of fundamental importance that your current implementation in Alberta be a success. And that's why we're going to have an Alberta focus at this point, to really hone in your skills into one specific market. But to begin immediately, what do? Well, you need to really sign contracts with those partners to make sure they're committed to joining this initiative and submit the proper legal documentation to have your organization properly recognized by the legal community. As well, we'd like you to do a vendor analysis. One of the things we recognize within Alberta, and really across the board in the country, is that there's a multitude of vendors and varying standards across provinces for those vendors. Well, we'd like you to have this added value for your clients or for your physicians. Let them know that you've already done an analysis of all the vendors in the market, and that you've decided already which are the best in that market, in that landscape, which meet your standards and ultimately will meet their standards then. And so this vendor analysis will give you that extra competitive advantage and really assist your clients who perhaps aren't familiar with the IT landscape. As well, we'd like you to develop, or we'll assist you in developing a change management procedure to really bring physicians on board on how this is going to affect them, how it's going to help them ultimately in terms of the triple bottom line, as Cameron mentioned. And you will listen to their concerns, address those concerns, mitigate them, and perhaps if they have any suggestions, at that point you can also implement those suggestions. To really bring your name out there as well, because you are not yet established as an organization, we'd like you to utilize your current network of physicians and others in the medical community, as well as go to trade shows and medical conventions to let doctors and physicians know that you have this opportunity to really improve their business practices, to improve the medical documentation of their clients and of their customers, and that you can really ultimately help the Canadian medical community with this service. Finally, in the short term, we'd like you to begin discussions with the province of Alberta. So let them know that you have this service, that ultimately a partnership between the province of Alberta and yourselves will be very beneficial for Canadians and Albertans as a whole. In the medium term, we'd like you to begin development of this e-note and selective integration system that we spoke of. Now, what do I mean by e-notes? Well, we'd like doctors to really write their personal notes directly on computers or perhaps on tablets and have that seamlessly integrated into the system. Again, that will be private. Not everyone will be able to see that kind of information. But it'll really have that extra value added for doctors who perhaps, or for nurses, for example, who aren't able to read all of doctors' writings, and for archiving purposes as well. At this point as well, we'd like you to begin having a very specific physician consulting focus. So what does that mean? Well, it means upgrading the proper technology infrastructure for those physicians, doing a customization and a compatibility analysis with those physicians as well, determining what their specific requirements are, what they're capable of, really seeing if perhaps a doctor's needs are compatible with that of a specific vendor, for example, and then customizing what's needed at that point. And doing a very in-depth security analysis as well, because medical information is very, very pertinent and very important data. And to have that information insecure is just not acceptable with the medical industry. So doing a very proper security analysis and determining that those channels are safe and secure is very important as well. In the long term, which will be 12 months plus, we'd like you to hire a security specialist to really handle the security side of your consultant and implementation group, as well as look at a private cloud that can be utilized for those physicians and clients, and that can either be through the province of Alberta or through other means, and expanding throughout the rest of Canada. And I'd like to stress here that this is very important, the success of this Alberta initiative will be the baseline for success throughout Canada, which is why we're suggesting that you focus really in on the Alberta initiative within that first 6 months. Now, as you can see here, we have an implementation plan in place that discusses the first year of implementation. There's a number of items that we'd like you to begin immediately, which include potential recruitments, having those legal documentation signed and ready and submitted, as well as doing that vendor selection analysis to determine the proper vendors and proper channels for any potential physicians and clients. And there's a number of items we'd like to do in the long term that we've discussed as well. Now I'd like to bring Julie up to discuss the financial analysis.
Thank you, Heidi. Okay, so looking at financials for our recommendation, the statistics that we've been provided prior to our meeting today include numbers and percentage of physicians that are right now, they have transitioned to electronic medical records. In Canada in 2010, that was about 10%. In 2013, that increased to 20%. So we have projected over the next 4 years to increase up to almost 30%. So this is definitely an industry where you can see the opportunity to take advantage of that room and growth requirement to transition to the electronic notes. We were informed that a target of 80% is highlighted because with integration of the health records and the medical records, you're going to see maximum benefit at once 80% of the country has that integration. So looking at the pan-Canadian electronic records, which is the overall goal right now in the health sector on an IT level, and we projected that you will be able to reach that target of 80% by 2028. I would now like to bring Heidi back to address the risks and how we plan to mitigate them.
Thank you, Julia. Thank you, Julie. Now, as I mentioned, a very important risk is security and privacy. That's why we rank that as a very high priority. And to mitigate this, we'd like to really have security and as a primary criteria for vendor selection, as well as implementing that security official in the long term. There's also the risk of decision resistance, which is why we'd like you to develop that change management procedure, and we can develop that with you as well as having original team members who perhaps aren't willing to join the team, but at that point, you can also hire additional consultants. And with that, I'd like to thank you for your time and open the floor to any questions you may have.
You mentioned the e-notes as an option for physicians.
that's a great question. It's already in the marketplace to do that. That will be involved in your vendor selection. When you're picking the vendor, you have to make sure that you pick a vendor that has the ability to integrate with a secondary group that provides this service. We didn't recommend that you do it in-house because we feel that in terms of vendor selection and implementation, you don't need the extra focus of actually coding and writing in this software. So it allows you to really focus on your core competencies and outsource the more technical side.
What do you guys see being your biggest barriers to entry into this market?
Sure, that's an excellent question as well. So right now, we've highlighted the threat and the barrier to entry really being the resistance of the physicians. So being able to take advantage of the opportunity across Canada, specifically in Alberta right now, which is where we initiated you to start, to approach various physicians and basically make a sales pitch to them, to make them understand that it's a need for them to enhance their systems, to transition to an ERM, to create that integration with their health records.
You touched on the importance of vendor selection. Could you maybe highlight the most important parts of that vendor selection?
Yeah, absolutely. One of the most important parts, specifically because of this particular industry, is security. You're going to be dealing with large amounts of private patient data, and it's extremely important not only for the reputation of your company, but even looking beyond just the profits in the beginning, looking at the ethical side in terms of how well are you keeping your patient information private. And the second aspect is does it work? Will it integrate with the current systems? And looking into the future, will it integrate with the future systems in terms of integrating all of Canadians' medical records, Canada's medical records as a whole?
Thank you.
To add on to my colleague's point, I'd like to mention that in implementation, we discussed a compatibility analysis with any potential clients or physicians. And you have to understand, and in understanding that, you recognize that some physicians perhaps don't have the resources to match all potential vendors. So you'll really see which vendors are applicable to that specific physician, see if they have the proper technology infrastructure, proper personnel on staff, or if they have the proper channels to really meet any particular vendor. And that will also be included while determining the vendor analysis.
Thank you.
In your long-term implementation, you discussed private cloud, and just want to understand that better. Is currently the 3 vendor systems that are certified fully offer an ASP or any of those systems? So I'm just trying to make sure I understand.
Okay, that's a great question, and it's one we thought about, and perhaps we didn't emphasize it enough in the presentation, but that's very long-term. That's one. Right now, the focus is on creating the infrastructure necessary throughout every single province to allow all of the systems and all of the records to be integrated. And once they are integrated, then you can start looking and talking with either InfoWay in terms of the Canada-wide or each province particularly, just to add that increased level of privacy for patient information, for medical records. But that wouldn't be until later, until all of the infrastructure is in place using the current software available.
Why did you guys pick Alberta to start?
When analyzing the data that you provided us, we recognized and saw that Alberta already had a very high usage rate of physicians who are using or transitioning to electronic medical records and electronic health records. And we recognize that physicians talk to each other, and if there's such a high success rate already, we can recognize that other physicians who want to remain competitive, and as we ultimately know, physicians working as walking clinics, they ultimately are for profit. If they want to remain competitive, if they want to provide the best possible health care, and look, I guess ultimately look beyond profits, look into providing the best possible health care possible, that is right now transitioning to e-records is the way to go. And since there is already such a high usage rate in Alberta, we recognize there is a market there in that